Our next guest is Pinar Ayaz, yes, also from Turkey. Welcome. Yeah.
Thank you so much.
Change the slides.
Okay. Okay. Hi everyone, my name is Pinar Ayaz and I'm also a lecturer in Hitit University. This study presentation will prepare it with my colleagues. And my topic is pain beliefs of nursing students and related factors. What is the research significance? The pain is which is one of the oldest and most complex health problems. Pain is a condition that people are exposed to more or less different reasons in every period of life, and pain adversely affects the patient's functioning and quality of life. Minimizing pain as soon as possible with pharmacological, non-pharmacological, and complementary therapies is one of the main goals of healthcare professionals. When pain is not well controlled, it may cause various physiological and psychological effects on the patient, as well as increase the risk of acute pain turning into chronic pain. In addition, inadequate postoperative pain control increases the cost of healthcare by delaying the hospital discharge time and prolonging the healing process. Although there are many factors that affect pain control and approach to pain, it is known that one of the most important of them has pain beliefs. Nurses have various responsibilities in questioning pain beliefs about how the patient identifies pain, evaluating how these beliefs affect ways of the coping with pain, and determine the appropriate method of coping. In addition, nurses who play a key role in the team and future nurses, students, nurses' own beliefs are as important as the beliefs of the patients in pain management. What is our research aim? This research was conducted to determine the beliefs of nursing students about the organic and psychological nature of pain and the methods they use to cope with pain. When we are looking at the methods part, this study design is descriptive study, and sample size consists of the 351 nursing students, and we collected the data in the State University between February and April 2023. And we have some inclusion and exclusion criteria. The inclusion criteria, age 18 and over, they have to speak Turkish, and they don't have any communication problems, and the voluntary agreed to participate in the study were included in this study. Data collection process, firstly we obtained the institutional review board of the university, and we used the two different questionnaire. One of is socio-demographic questionnaire, and other is the pain belief scale. The data were collected during the course hours of the students in the nursing department of a state university, Faculty of Health Science. The purpose of the research, inclusion criteria, the question were explained. The students' informed consent was given. Those wanted to participate, their signatures were taken and questions were given to the students. It took about 50 minutes for the students to fill out the questionnaires. To ensure confidentiality, participants were assigned a code number and to all study materials. Data analysis, we use the SPSS program, and we use percentage, median, Kruskal-Wallis, man with NAU test, and Superman correlation analysis. In the result parts, our participants, most of them are women. Most of participants are second-year students, and their age is 20 years. And most of participants live in the government dormitories, and a high percentage of the students say that they did not have any chronic disease. And the median scores of the students in the pain belief scale were found to be 3.50 in the organic subdimensions and 2.25 in the psychological subdimensions. In the pain experiences, most of students suffered from pain once a month, and the pain parts are head and neck pain. 70% of the students experience moderate pain, and generally the pain cause is fatigue, stress, and menstruation. 31.9% of the students prefer to use pharmacological and non-pharmacological methods together. And when we are looking for distribution of the scores obtained from the pain belief scale according to the demographic characteristic and pain experiences of the participants, organic pain belief was found to be significantly higher in 4th grade students compared to others. Physiological pain belief is the highest among students staying in private dormitories. Organic pain belief was significantly higher in those who described their pain as severe, very severe, unbearable. Organic pain belief is higher in those who use pharmacological and non-pharmacological methods together to relieve pain. Correlation of variables associated with students' organic pain beliefs. A positive significant relationship was found between psychological pain belief and organic pain belief. A significant positive correlation was found between the ages of the students and their organic pain beliefs. A significant positive correlation was found between students' grade level and organic pain beliefs. In the discussion part, generally we have the same result with the literature. In the limitation, the data is collected only at certain time intervals during the course hours. Some students do not want to participate in the study. The failure to collect data from students who are absent from classes. The first-year nursing students have less knowledge about pain-related coping methods than other classes. And the conclusion and recommendation parts. The organic pain belief of the students was higher than the psychological pain belief. In addition, it was determined that students with high organic pain levels used non-pharmacological and pharmacological methods together to cope with pain, and their age and class level were higher. It is recommended to make the subject of pain more comprehensive in undergrad education in order for students to learn pain beliefs and current pain coping strategies throughout their education process. In addition, it is another suggestion to determine the psychological factors affect pain beliefs and pain management by conducting more studies on the subject. It should be aimed to increase the awareness of students who are health professionals of feature about pain beliefs and thus to provide more effective pain management. These are references, and thank you for your patience.
This is Ayaz. Do we have any questions from the audience? Yes, of course.
So the study was conducted only in one university?
Yeah, right.
Only one university?
Yeah. Mm-hmm.
So the university had 3 years students of nursing?
4 years.
4 years.
Yeah.
So one of the results was there was a significant difference or correlation between the age of students and organic pain belief.
Yeah.
So who had the highest or severe pain belief in terms of the age?
The age?
Younger people or the oldest?
Younger people, yeah.
Okay, why do you think there was a strong belief about the pain among young people compared with the older students?
I'm not sure.
Okay. So one question, another question is, because you measured the belief, yes or not?
Yes, right.
So why you didn't do qualitative study instead of quantitative? Because the tests you use, such as Cross-Calvaris and Mann-Whitney, yes or not? they are actually showing no parametric test. Means your sample size was low,
the problem-
358,
Yeah.
because you did no parametric test. Why you didn't do
The
qualitative research?
problem is in the Turkey, generally, they don't want to, the easiest to data collection and for publication. So we generally prefer to quantitative.
Yeah. One of the objectives of your study was to identify the coping strategies of students, yes or not? So what was the result for that? What is the most coping strategies among the students?
I don't understand your question. Could you say again?
One of your objectives was coping strategies. How can get rid of the pain? Yes or not? This is coping strategies you mentioned in your objectives. So I want to say, what was the most common coping strategies among the students?
Generally, they use the painkillers, most of them.
Pain relief.
Yeah.
Okay.
Yeah, massage also.
Okay. Thank you so much, Doctor. Well done.
You're welcome. Thank you so much.
Yes, it's a question a little bit. Okay, why or would you think to use some natural medicines in your studies? Why, for example, only the painkillers, the chemical painkillers?
Yeah, generally they prefer to painkillers. It's most of use them because they want to. It's the easy results. Yeah.
Okay. So, are you open to this direction? This is a question because I wanted to do it for you also. Are you open?
Are all of the health science students, and they didn't use commonly alternative
Yeah.
No. Okay. Okay. Thank you.
That is a good conclusion based on her information that you can promote the knowledge of the students to use, yes, non-pharmacological treatment, yes or not?
Yeah.
And using herbal or actually these types of pain reliefs. Yeah, that's very good. Or even you can develop proposal for future research to identify how can promote their knowledge by using different interventional approach.
This is a good advice. Thank you so
thanks.
much. Yeah.
Actually, I have a proposal for you. I have a proposal for both of you.
Yeah.
Since we are neighbors, also I'm from Greece. Okay, I'm naturopath. I was thinking about the flower essences that I have much experience, and it's very helpful for psychological issues we have. And it helps very much, after all, like indirect way, the pain. So I really would like to talk to you about how also in the older people that they have cataract, then they have depression and all this that can help. Okay.
Yeah. Okay. Thank you so much. We will happy.
Thank you. So unless there are any more questions or topics, I would like to thank you very much for your presentation. Thank you.